If the screen that is on here is black, will it show up like how?
There, yeah.
How will I know if it's on?
So,
Okay.
it's on.
Okay. It's on. Happy day. Good to know.
Anytime you're ready.
Imagine sitting in your doctor's office. It's been several days since you've worked due to the headaches and nausea that won't seem to go away. As your doctor examines you, you think to yourself, could this get any worse? Your boss just called this morning and told you that if you missed another day of work, that you would lose your job. You need this job. You have a wife, 2 kids, and another one on the way. After a thorough examination, your doctor suggests taking a CAT scan. You agree, hoping that the doctor can figure out what is wrong, so that you can return to work tomorrow. After looking at the CAT scan, you see your doctor's face go to stone. You could never imagine what he was about to say next. He said, "You have glioblastoma, cancer of the brain. I'm sorry, but there's nothing we can do for you." Your day did just get worse. Cancer affects millions of people every year in the United States. And although there's no complete cure, there is a new medication that, according to Biologics New Miracle Drugs by Mary A. Fisher in the November-December edition of AARP magazine, is designed to slow down or even stop the cancer tumor. It is called Avastin. So today I'm going to talk about, first, the current situation of cancer, second, what Avastin is, third, what the cost is, and finally, what the predicted prognosis for cancer is. The first thing I'd like to talk to you about is the present situation of cancer. According to statistics found on www.cancer.org, last visited on March 16, 2010, a total of 12,479,350 patients were diagnosed with cancer in 2009. According to the past facts and figures, it is predicted that 39% of these cases will result in fatality. I'd like to now look at the 3 types of cancer within the United States that are most highly diagnosed. These include metastatic colorectal cancer, also known as mCRC, non-small cell, non-squamous cell lung cancer, which is also known as MSCLC, and finally metastatic breast cancer, which is also known as MBC. Of those cases, it is predicted that 34% of fatalities will result in patients that are diagnosed with colon and rectal cancers. Also in 2009, of the 209,400 diagnosed with the NSCLC, 73% will result in fatality. And finally, in 2009, of the 194,280 new patients diagnosed with breast cancer, of those diagnosed, it was predicted that the fatalities will arrive around 21%. Now I've talked to you a little bit about the current situation of cancer. I'd like to direct your attention to the recent medical breakthrough called Avastin. According to www.gene.com, last visit on March 16, 2010, Avastin was first released by Genentech in February of 2004 for the treatment of first-line mCRC. Since then, Avastin has been approved for the treatment of other cancers such as second-line mCRC, MSCLC, and MBC. But how exactly does this drug work? Although scientists are unsure as to the exact way Avastin works, according to Fisher, as well as www.avastin.com, last visit on March 16, 2010, Avastin is considered a monoclonal antibody and falls into the category of anti-angiogenesis therapy. Angiogenesis is a process in which the blood vessels grow towards the tumor to provide it with the oxygen and nutrients needed to grow. Avastin works by attaching to the vascular endothelial growth factor proteins, also known as VEGF proteins, which are located on the surface of the tumor and are responsible for the growth of the tumor. When this happens, the growth of the tumor is either slowed down or stopped. According to Fisher, this is a process similar to the way that the antibodies in the body work to fight off bacteria and viruses. As well as being an anti-angiogenesis therapy, Avastin is also considered a biological therapy and differs from chemotherapy in the following way. According to www.cancer.gov, last updated on December 12, 2004, chemotherapy attacks the cancer cell directly, whereas Avastin works with the body's immune system to fight the cancer. According to Fisher, other biological therapies include medication to treat autoimmune diseases such as rheumatoid arthritis and multiple sclerosis. One disadvantage to this so-called miracle drug is the possibility devastating side effects. According to the medicine label provided by Genentech, last visit on March 16, 2010, it is reported that the treatment is discontinued in 8.4 to 21% of all patients due to these adverse side effects. Some of the most common adverse side effects include headache, hypertension, taste alteration, dry skin, rectal hemorrhage, and back pain. There are also other side effects that aren't as common but are possibly fatal. These include gastrointestinal perforations, surgery and wound healing problems, hemorrhaging, and infusion reactions such as chest pain and wheezing. Now that I've told you a little bit about what Avastin is, I'd like to talk about the cost. According to Genentech spokeswoman Christina Becker, in response to an article entitled FDA Approves Cancer Drug That Few Can Afford, written by Brandon Keem and published on www.wired.com on February 25, 2008, Avastin costs a total of $92,400 annually. According to Fisher, as well as an article in November-December publication of AARP magazine, What Pricing Miracle, by Cherie Krupp, the reason for this large amount of cost is due to the fact that Avastin is made to specifically target the VEGH proteins involved in the disease. In order to do this, the VEGH blocking proteins must be extracted from living organisms, such as bacteria, which is a long process that requires time and precision. Earlier I discussed with you the current situation of cancer. Now I'd like to take you and direct your attention to the future prognosis for this Avastin. Although Avastin is currently approved for 5 types of cancer, I'd like to focus on the 3 types that, according to www.cancer.org, last visit on March 16, 2010, are among those most diagnosed within the United States. These statistics were gathered from the medication label provided by Genentech. The success of Avastin for each type of cancer can be measured in overall survival, or OS. According to www.cancer.gov, last visit on March 16, first-line therapy is the therapy given to a patient before starting any other type of therapy in hopes to reduce or even stop the cancer. So the first type of cancer I'm going to talk to you about is first-line MCRC. For first-line MCRC, the initial OS for patients is about 15.6 months. When Avastin was coupled with IFL chemotherapy, the OS increased by 30%. The second type of cancer I'd like to talk about is second-line MCRC, which, according to www.cancer.gov, last visited on March 16, 2010, is when second-line treatment is administered because the first-line treatment either didn't work or stopped working. For second-line MCRC, the initial OS for patients receiving FOLFOX chemotherapy was 10.8 months. After the addition of Avastin, the OS increased by 20%. The third type of cancer I'd like to discuss is NSCLC. Patients receiving only PC chemotherapy had an initial OS of 10.3 months, but the addition of Avastin increased it by 19%. The final cancer I'd like to discuss is MBC. The initial OS for patients who were treated with only paclitaxel had an OS of 24.8 months, whereas the patients who were receiving Avastin had an increase of 7%. So today I've talked first about the current situation of cancer, second, what Avastin is, third, the cost, and finally, the predicted prognosis for this disease. Although this is not a complete cure for cancer, I believe that we are on the road for the cure of cancer. It was only 6 years ago that this medication was prepared to slow the growth of the tumor. I feel as though it is only a matter of time before scientific discoveries allow us to find a cure for this devastating disease. Thank you.